Hi there. Thank you for joining me. I am Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. This program is called Your Doctor and COVID, and I'm very pleased to have you join me today. As you can see, I'm wearing my mask today in studio, but I will take it off for the rest of this episode because I am alone in studio. There is no one here to put me at risk, and I am putting no one else at risk. This is the way to wear the mask, to completely cover the nose and the mouth. So I'll take it off now so that we can continue our conversation. Today we will be examining a very important and common concern shared especially by parents. And it has to do with children in the COVID-19 pandemic and in the era of dealing with COVID. So we are getting our feedback, our questions, our emails from viewers and listeners just like yourself. And remember, feel free if you have any questions or concerns that you would like to communicate with us. The WhatsApp number is 620-6275. And email is docandcovid@gmail.com. So here is our scenario. The first scenario. My adult daughter recently tested positive. She has no symptoms. She has 3 children. They're 8 months, 3 years, and 5 years old. And they all live in the same home. So you can imagine how concerned the mother is, and of course the grandparents or the person who sent us that scenario. So here are the specific questions that were asked regarding this scenario. 1, can the mother infect the kids? 2, should the children be tested? And 3, and this is a very practical question, can a relative look after the children while the mother is in isolation? And here, this question is being asked if the children can probably come out of the home and go and stay by a relative while the mom is being kept in isolation, or maybe the mom staying in the same home in an isolated room and a relative coming home to look after those children. And you can imagine children 8 months, 3 years, 5 years, they need a lot of supervision. They need someone to prepare meals for them. They may need someone to help them bathe and do basic regular things. Children at that age absolutely need proper adult supervision and adult care. So that's a very important question. So let us look at the first part, the transmission. And transmission can be considered in several stages, but let us look before birth, while the woman is pregnant. Is it possible for transmission to occur? Well, based on the limited data, there is no confirmed case of vertical mother to fetus transmission. That is, no cases have been recorded of a pregnant woman transmitting the virus from herself to the unborn child. So that is an important fact to bear in mind. The next one is, as of now, the SARS-CoV-19 virus has not been detected in breast milk. And this is very important because mothers, the best nutrition for children at that age is usually breast milk. And as part of our public health policy, in Guyana and many countries around the world, breast milk is best, and we continue to encourage mothers to breastfeed. Mothers, however, can transmit this infection to older children, usually through contact or aerosolized particles in the air or droplets if they're sneezing or coughing. From mother to child, it can be transmitted that way, and that is the older child who is actually around the mother. Or if the mother coughs or sneezes and that ends up on a particular surface, and children love to touch things, then touch their faces, touch their mouths, their nose, they rub their eyes. So these are all potential ways in which children can actually become infected from not just the mother, but an infected parent or household contact. Okay? So let us bear those in mind. So we're looking now. So first we addressed transmission from an adult or a parent in the home to a child. We said that we do not have evidence that transmission occurs while the baby is unborn. But once the baby is born, it is possible for the mother or a parent or a household contact to transmit to the child, either directly or through the air or on surfaces. So COVID-19 in children, it is not as common as in adults. In fact, let us look at statistics from the United States. Of all the positive cases of COVID-19 that have been recorded, less than 10% were actually children. The real number is 7.3%. Most cases in children are mild. Worst cases, however, can be seen in those younger than 1 year. And we think that that's so because those kids do not yet have a mature immune system. And so they are therefore at higher risk for picking up these types of infection and becoming severely affected. However, the majority of children who are infected have only mild symptoms, and we will look at some of those symptoms in a little while. They will therefore need only supportive care, just, proper food, hydration. If they have a fever, you would wipe them down, or some Panadol, etc. Those are simple measures that are usually required for children, nothing fancier. And why is that? And why do we have challenges in children? Because there are no drugs or any medical products that have been approved for use in children to treat COVID-19. So we have had several approved medications for adults, but unfortunately for children, we do not have the options that we have in adults. In fact, there's also no approved vaccines for COVID-19. And many of the vaccine trials that are ongoing at this time do not include children as test subjects. They are usually enrolling healthy young adults. They're not enrolling children or the elderly. And we know for sure that the elderly population are actually much more at risk. So it's a concern that the vaccine trials are not including this population in their trials. So the next thing we want to look at are the signs and symptoms that can manifest itself in children when they become COVID-19 positive. The most common is cough and fever. And if you have kids and you've been around kids, you know that kids a lot of times have cough and fever or cough and cold. But in this particular case, this happens to be the commonest of the symptoms that children present with. Of course, there are things like shortness of breath, sore throat, or more medical term, we call it pharyngeal erythema. Children oftentimes can have diarrhea, muscle aches, fatigue or runny nose, vomiting, nasal congestion or stuffiness. They may have abdominal pain, conjunctivitis or redness in the eyes, and there's a specific type or specific types of skin rashes that can occur. There is a more serious consequence that occurs, thankfully, rarely in children, but it still does occur, where there is a multi-system inflammatory process that happens. And the most dangerous part of this is the effect and the long-term potential effect it can have on these children's heart. You can have dysfunction of the heart muscle, or what we call left ventricular dysfunction. That's the part of the heart responsible for pumping blood to the rest of the body. That can become inflamed and a bit weakened. The arteries of the heart may also, in a long-term basis, become dilated and produce dysfunction in blood flow and blood supply to the heart muscle. And the inflammation can actually cause pain around the chest area as well. The skin changes in children who have COVID-19 are quite interesting. They can range from what we call hives, or what looks like allergic reactions that can be itchy. And if these children are in cold climates, the tips of the fingers and toes can have a similar appearance to frostbite. But if a frostbite type appearance occurs in the tropics or warm climates, then that is not typical of frostbite, of course, because there's no snow. And so you may want to consider that this is particularly concerning for COVID-19 in these children. And for those of you who can actually see the pictures, you may see what it looks like, and I can describe for our listeners. It's the top of the toes can become red and appear inflamed, and the same things can actually happen to the fingertips as well. So these are skin changes that can occur in COVID-positive children when they become sick. Now, when do you seek help for children? Children can become sick quite suddenly, and they can progress from a stable, playful, healthy eating child to a very sick child in a very quick time. And it's very important to recognize signs early and seek attention. Now, when should you take the child to see a doctor or seek attention? If there's any trouble breathing, if the child has severe belly pain or tummy aches, if he or she has pain or pressure in the chest, if there's any indication that the child is confused or not making sense when you're talking to them or when they are talking to you, that might indicate some processes happening in the brain that it's time to take action. If the child is having trouble staying awake or the excess sleepiness, that is something to be concerned about. And of course, if they're getting a little bluish in the lips or the face, that usually means they're not getting enough oxygen, or there is a systemic inflamed process or infectious process that's happening, and you need to seek immediate attention for these children. So four things that you need to know about what I spoke to you about before: the multisystem inflammatory syndrome in children, or MISC. It appears to be a rare condition in children, thankfully. What is scary, it may show up weeks after COVID-19 infection, and it can cause inflammation across multiple organ systems, including the heart, the lungs, the kidneys, and the brain. It may also affect the eyes and the skin, as well as the tummy. And it can produce varying symptoms in children, but these can include fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, and children feeling extra tired. The question is, should children be tested? The recommendations are only when there are suspicions of symptoms such as fever, cough, shortness of breath, or if there is a high-risk travel history, if the child is in contact with a confirmed COVID-19 case, or if there is a local epidemic that is happening, or there's a lot of cases happening in that area. And of course, one must always try to rule out all other causes of the illness before putting children through the kind of testing that is required for COVID-19. How do you actually care for someone with COVID-19 at home? And this is a question, the last part of the question. You need to separate the family member who has COVID-19 from others. Of course, this can be a challenge in some homes, in some circumstances. But as much as possible, use separate room and bathroom if possible, and limit visitors to the house. Avoid contact with pets. Avoid sharing personal household items like dishes, drinking glasses, and cups. And do extra cleaning for all high-touch surfaces, which would include like countertops, tabletops, doorknobs, etc. And of course, monitor for symptoms. Call your doctor or health department right away if the symptoms get worse. So thank you very much for joining us today. And remember, if you have questions, you can WhatsApp to 620-6275 or send an email to docandcovid@gmail.com.